The job I have chosen throughout the therapeutic services pathway is a physician. My 3 job places are Comp Health, Prime Care Managers, and Physician Pediatrician. Comp Health pros: you would make at least $2,100 a day. You have a 7 on and 7 off schedule from 7 a.m. to 7 p.m. You have 15 to 18 patients per shift. In addition to the shift pay, you will also be provided with medical benefits, a retirement plan, life insurance, disability, and malpractice insurance. The cons would be that it is one of the largest permanent and temporary staffing firms in America. And Prime Care Manager pros: a base salary plus a production bonus, company-provided health insurance, 401k plan, licenses and fees, continuing medical education allowance, paid vacation, continuing medical education. The cons would be the physician will supervise both family practice and pediatric nurse practitioners. The practice demographic range includes patients of all ages and payer mix, and minor surgical productions. Physician Pediatrician pros: you will enjoy living and working in this town if you like a slower pace of life and getting to know your neighbors. Large cities amenities for your occasional weekend getaway, Monday through Friday work schedule, 100% outpatient, base salary of $240K. The cons would be the shared phone call only, work alongside other providers, and BC or BE. In conclusion, I would say that the one I like the most would be Comp Health because of the $2,100 a day. Also, the schedule is like you have 7 days to work and then you get 7 days off, so it's a little break. And the one that I like the least is the Physician Pediatrician, only because it's so far away. Coach Dyson said, "Where's your value at?" And I thought,
when we arrive in the morning around 7, we start out by getting sign out from the team that was on overnight. We kind of go through the computer and look at all the vital signs and see all the different things that happen with our patients overnight. We get together with the attending, and sometimes there's a fellow there depending on what service you're on, and all the medical students, the intern, the senior resident, and then we do family-centered rounds here, which means we walk around and stop at every patient's room, talk to the parents, make sure they can listen if they want to, making sure that they're informed and actually present when we're discussing their child, which makes them feel like they're actually a part of the team that's helping make decisions as far as what's best for their child. So here at Nationwide Children's, we see a huge variety of patients, anywhere as far as age range from newborns all the way up to adults. We see a wide variety of diagnoses here, anywhere from general pediatrics to very specific problems that fall within subspecialties. After we finish rounding, we go to our noon conference, which can consist of a lot of different things. It kind of changes every day of the week. Sometimes we'll have one of the residents present an interesting case that they took part in, and we will participate as the people attending the lecture to help come up with the diagnosis. And then sometimes we'll have one of the attendings from one of the subspecialties come give us a lecture. Kind of depends on what day it is. As an intern, your role is more of a kind of on-the-fly teacher, so answering questions along the way, discussing your specific patients with them. And then as you get older, in more the second and third year of residency, you kind of have more time to sit down with the medical students and go through actual lectures or talk them through a specific topic. You can kind of help coordinate between all the different subspecialists that these complex patients will see, and kind of manage and make sure that nothing's slipping through the cracks as they're seeing all these various doctors. And then you also, again, see the well child checks and people coming in for a cold, just bread and butter pediatric cases. So I think the people here in this program at Nationwide Children's really made the difference for me. They set up a culture of learning and not being afraid to ask the questions that you have. If you feel like everybody around you is there to support you and truly help you learn, then it's easy to get what you need out of the residency as far as education, as far as emotional and social support.
So where's my value at? My value is in helping people. Think about the golden rule. Do unto others as you would want them to do unto you.